Hello everybody and welcome to the Thursday edition of Video Clips, and I have an interesting topic for today that's a little bit outside the box. I want to talk about music therapy. I have an interest in this for a couple of reasons. One of them is I was a piano performance major in college the first time I went to school, and a French minor, and I quit school, dropped out when, 3 years in or something like that. I didn't see much of a market for concert pianists and people who spoke French, and I wasn't all that enamored with it anyway, but I have a lifelong love of music, and so that's near and dear to my heart. But the other thing is that anything that is non-toxic, non-invasive, inexpensive, that might help somebody to even feel better, particularly if they have conditions like cancer, or some terminal condition, I think is a good idea. So anyway, I'm just going to tell you a little bit about it, and I was astounded at how much research I was able to find on this. So music therapy is defined as the use of evidence-based interventions by a credentialed professional to address physical, emotional, cognitive, and social needs of individuals. Music therapists help patients to create music, to sing, move, listen to it, depends upon the skills or abilities, physical and mental abilities of the individuals. The fact that music can be used as therapy, I don't think should surprise anybody. I mean, most of us like music, and humans are actually hardwired to respond to it. Research shows, for example, that 5-month-old babies recognize and are affected by sad songs, and by the age of 9 months are capable of categorizing songs as happy or sad the way that adults can. Now, this is not through verbal explanation, but by watching babies and their demeanor as they listen to various pieces of music. Aristotle and Plato wrote about music therapy. They weren't calling it that back then. But its modern use began after the two world wars, when both professional and amateur musicians were recruited to play at veterans' hospitals. Hospital staff observed that the patients had such measurable improvement that hospitals eventually decided to actually put musicians on staff. Today, music therapy is used to help people with many physical and emotional conditions. As I mentioned before, it's a low-tech, low-cost intervention that has no real downside. Unfortunately, insurance rarely covers it, and unfortunately, too, healthcare professionals don't recommend it. And I have to say, sitting here in this office, I haven't recommended it probably as much as I should. The positive effects of music therapy on such a wide variety of conditions can best be explained by a broader look at brain function. Neuroplasticity is defined as the brain's ability to reorganize itself by forming new neural connections throughout one's lifetime. And this allows the brain to compensate for injury or disease, and also to respond to sensory input, new situations, and changes in the environment. So our brain is constantly remodeling itself in very important ways. There are several mechanisms by which the brain makes these adjustments. For example, normal axons will grow new nerve endings in order to reconnect with damaged neurons and form new neural pathways. And if one hemisphere of the brain is damaged or rendered completely not useful, for example through stroke, the undamaged section will often take over many of its functions. One of the best books written on this topic, by the way, that I particularly like is The Mind and the Brain by Jeffrey Schwartz, MD. He discusses how conditions ranging from dyslexia to stroke can be improved or even resolved based on the neuroplasticity of the brain. And I did an advanced study course on that book. It was one of the more popular books I think we covered last year. Dopamine is a neurotransmitter, and dopamine pathways in the brain contribute to reward-related learning. In plain terms, this means that people experience feelings of pleasure in response to many experiences, which include eating food, we all know that, right? Music, unfortunately, drugs. Neuroimaging shows that music can modulate activity in areas of the brain that are involved in emotion, which is one of the reasons why music has been shown to be helpful for people with psychological and neurological disorders. Imaging has also shown that listening to music results in dopamine release and feelings of euphoria and craving that is, for more music. Isn't that nice? Based on its effects on brain function, music is proven to have a very positive effect on outcomes for people suffering from many different disorders. Now we can understand actually why that happens. In many cases, it can help people who are unable to express themselves effectively due to issues like stroke or autism or PTSD. Music therapy improves rhythmic limb movement, gait, and freezing, and has been shown to improve the quality of life and for patients with Parkinson's disease and for their families, I might add. Music therapy has been shown to benefit stroke victims, improving social function and mood during acute rehabilitation. Music therapy decreases levels of anxiety and depression in cancer patients. It's been shown to reduce pain by decreasing pain perception through distraction, improved mood, and relaxation. Music can be particularly helpful for children who have a variety of issues. One example, a 2-year intervention program for at-risk children involved participation in a community program. It resulted in improved speech and better auditory processing. Music therapy significantly improves social, emotional, motivational development, and communication skills in autistic children. It can reduce stress and fear in cancer patients, reducing anxiety, pain, side effects of chemotherapy, and improving relaxation, mood, and quality of life. Music therapy can be as simple as self-administered. We can listen to the radio, we can attend a concert, we can play CDs at the office or at home on a CD player, or it can be a form of structured intervention for a variety of conditions. The American Music Therapy Association offers an online directory of certified people, qualified therapists, and offers advice on how you can check out the credentials of somebody who you might select from the site. Well, as I mentioned in the beginning, I am for any therapy that can enhance health and well-being without risk, and I think we should offer this to patients, especially those who have conditions that are difficult to treat. I mean, cancer patients often have a very difficult time, even those with reasonably good prognoses. So no reason why we shouldn't be telling more people about this, but particularly in cases where medicine doesn't bring a lot to the table to offer. So when I started researching the topic, I was astounded at how much research is out there. This particular article has 14 references, and I found myself with so many studies to look at, I had to select a handful and some of the better structured studies to include here, or this video clip would have gone on for hours. And maybe someday I'll do a whole 2-hour presentation on music therapy, which I think would be interesting, but recommend it highly. I love music myself. As I mentioned, my educational background started that way. It's been a very important part of my life, and so we probably should make it a more important part of treatment. All right, that's all for today and for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.